Hey everybody, I'm Jill at the AAFE Training Center, and today we are going to do a really pretty lip case. You can come on in. The last time this patient had her lips filled was December, and she feels like they've just deflated a little bit. So we're just gonna go back and add some just standard volumization, but you can see she has a really pretty shape. She has a nice pretty pink cupid's bow, and her bottom lip is just nice and full. So we're just gonna add a little bit of extra volume just to give her that little bit of a plump.
Thank you, Jill, and I'm going to take you through what Jill is doing so she can concentrate on giving this patient what she wants. And again, we're going to concentrate here on volume. The patient feels that her lips have deflated a little bit, so we're going to go ahead and concentrate on volume. And we are using, as you can see, a great medium to medium heavy filler, and that is what is going to do the job for us very nicely. Every single place that Jill is placing filler is strategically placed because she wants to go ahead and access and highlight certain parts of the lip by adding volume so she can see. In this case, we are going, it's always, you've got to decide what you want. Do you want projection, which means that forward, the forward projection of the lip? Do you want lip show? This patient's got really nice lip show, and in her case, we're going to go ahead and add some of that volume back. It'll give her a little bit more of a lip show, but she feels, and it's really crucial to understand what patients are saying when you listen carefully to them, she feels that it's deflated a little bit, so we're going to inflate them a little bit by adding some filler volume here. And she is going, staying fairly superficial. All the vasculature is underneath there. She's giving small threads of filler with each injection here, always keeping that needle moving, always going ahead and giving just a little bit of filler, always keeping her eye on the tissue to make sure that you never get into a vascular event, which would go ahead and blanch the tissue, and certainly you would want to address that right away. Super important that you know the AAFE Safe Injection Perfection Technique, which encompasses many of the things that I just described in giving a safe injection, and especially in the lip or anywhere on the face wherever you are using fillers here. So now we are just going, and this is all done by sight, and again, a large part of this is talking to the patient beforehand so the patient can identify for you. And this is a great patient because she knows her lips. She knew exactly where she wanted to add some and where she wanted to really highlight, again, that deflation that she felt that occurred. But it's pretty much generalized, but you can see slowly but surely you get absolutely no rewards for going fast in any kind of an enhancement. And what you want to do, another thing that Jill is doing that you may not realize, is she filled up one side, she added some to one side. Look how beautiful that looks already, but she added up to one side, she's going to the other side while she's working on the contralateral side. The first side of the filler is absorbing some water. It's going to get more towards its final shape, and that is going to give Jill the option to go ahead and go back and evaluate side by side. And you can see as she moves around the patient. It's very, very deliberate. It's not just about throwing tons of fillers into lips, because that's when you get all kinds of problems. Now that ever important pout, it's going to be rounding out that pout, and that's why. And also there, you go from the lip border to the wet dry line. You can see Jill has varied within that distance. You never want to be obviously behind the wet dry line, but she's varied in that distance depending on what she wants to accomplish. Now she is using the AAFE exclusive V to M technique to really create some planes along. If you know lips and you've really studied lips, lips are not one big sausage going from one side to the other. Lips have a certain anatomy. You can see those nice hills and valleys, and she is accentuating some of that right now. And that's exactly what she is doing using the filler, and in this case we're using the filler syringe. Many times we will use some ComfortDoc syringes backfilled with filler if we want to get even more precision in here. Now going all the way down to the vermilion border to really round out that lower lip and really round out that pout. Look how gorgeous that looks right now, and you can see that little bit of filler. And if you've been watching her syringe, she's probably used about a half of a syringe, 0.5 ml or getting close to it. For that, now she's going to really accentuate the Cupid's bow with very, very precise injections. You can see that white roll and that definition in the vermilion border. We can also create that with PDO threads. Here she's doing it just a little bit of filler to get that peak on that Cupid's bow. And this patient will be a little bit swollen initially, so we'll get her back, but we'll get her back to evaluate the final result. But this is pretty close to the final result. You can see really no bruising that has happened, tiny bit of bleeding here and there, constant evaluation by a great clinician who has been AAFE certification trained, and that's something you should consider too. That's how you develop great lips. Great lips makes your practice because it is the most popular dermal filler service. Certainly so many millennials are coming in just for lips. That's their first service, is just for lips. Now the ever important AAFE smoothing technique. Smoothing is an art form to really go ahead and manipulate that filler to exactly where you want to put it. So you can see some of the great techniques that Jill teaches as a faculty member and learned during her AAFE certification training. So it's time for you to get AAFE certification trained. Now we're going to set it back to Jill for the final result.
Hey everybody, thanks for watching. We just finished this beautiful lip case. You can see we've just added a little bit of extra lip volume just to give her a little plump. Again, it's been about 7 months since her last lip fill, and so we're just sort of restoring a little bit of that volume. We also did a little work on her oral commissures as well. So thanks for watching.